Assalamu alaikum. Welcome again to Corona Sey Agahi, Habib University's bulletin to keep you all updated on the situation regarding coronavirus in the country. There have been a fresh spike in the cases regarding coronavirus in all over the world, especially in Europe and America, and Pakistan is actually no different. Unfortunately, in last couple of weeks, there have been a gradual increase in the number of positive COVID cases, and in this bulletin we'll be discussing what exactly the data suggests, what the exact situation is regarding the second wave of coronavirus, and to discuss the health implications and how to contain this virus, what worked for us in the past and what may work for us in the future. We'll be having Dr. Saeed Qureshi today as a guest in our bulletin, who is a Vice Chancellor at our University of Health Sciences. So let's start our bulletin. और हमारे साथ आज का डेटा सेगमेंट में मौजूद हैं शाहजेब आलम, who is Habib University alumni and also a data scientist. Assalamu alaikum शाहजेब.
वालेकुम अस्सलाम अक्सर, आई एम गुड, हाउ आर यू?
बिल्कुल ठीक ठाक. तो शाहजेब, अब हमें ये बताएं कि वी आर हियरिंग सम रियल बैड न्यूज़ रिगार्डिंग कोरोना. हाउ अलार्मिंग इज दैट, एंड दुनिया भर में इस वक्त क्या सूरत हाल है कोरोना वायरस को लेकर?
We will use John Hopkins dashboard which was updated on 14th of October. अब इस वक्त की सूरत हाल ये है कि the global confirmed cases is about 38 million. तो कहाँ हम 3 million से बाद शुरू हो के that time it was a big deal for us, and now we are at 38 million confirmed cases globally throughout this pandemic period. And the deaths now have, in fact, जो पहले हम cases की बात कर रहे थे, but now the deaths, the global number of deaths as confirmed on John Hopkins dashboard is above 1 million. The US की कहानी, which again remains the country with the highest number of confirmed cases, is above 7 million and almost touching 8 million just in USA alone.
So that's pretty alarming in Europe. Pakistan के हवाले से बताइएगा शाहजेब. There was this interesting point that one of the physicians made कि पाकिस्तान जो है उसमें कोरोना वायरस जो है गया तो बिल्कुल भी नहीं था, लेकिन एसिम्प्टोमेटिक केसेस जो हैं वो बहुत ज़्यादा बढ़ गए थे और टेस्टिंग जो है वो उतनी ज़्यादा नहीं हो पाई थी, जिसकी वजह से एक्चुअल नंबर ऑफ़ केसेस हमारे सामने नहीं आ सके थे. हैविंग सेड दैट, जो एक्टिव केसेस थे उनकी तादाद में तो कमी आई थी. अब क्या सूरत हाल है इस हवाले से?
However, abhi, as of now, the total number of confirmed cases is 320,000, just above that, and 6,500 almost deaths have been reported. So that's 2.1% of the total number of confirmed cases have the people have deceased, whereas we've had 95.2% recoveries from the total number. And active cases right now is reported as 8,782. So what we can see now in terms of the trend here is that clearly we were at a severe stage during July, where we were crossing and touching almost 3.5 thousand cases on a daily basis. However, that really came down even despite Muharram, despite Eid. These numbers came down and they were being reported below 500 for the months of August and September. And in the past 3 weeks almost, we have seen that the average has slightly gone above 500. So again, nowhere as close to the first wave that we had. However, this is enough of an indication for us to ensure that we continue to follow the SOPs and continue to control our movements, restrict our movements. And the governments in response to this are currently considering again putting restrictions on shadi halls and even closing down schools.
Thank you very much for joining us.
Thank you, Aksa. Thank you for having me.
और अब हम बात करेंगे डॉक्टर सईद कुरैशी से, हु इज़ अ सीनियर जनरल फिजिशियन एंड वाइस चांसलर डाउ यूनिवर्सिटी ऑफ हेल्थ साइंसेज. Assalamu alaikum, Dr. Qureshi, and thanks for joining us today.
Well, thank you very much for asking me to be here today.
Dr. Qureshi, my first question to you would be regarding second wave of coronavirus in Pakistan. We somehow successfully managed to contain it in its first part, but now how do you see it? Is that really alarming?
COVID struck Pakistan in late February, and subsequently there was a huge upsurge, and we had huge number of cases both in June and July of this year. Subsequently, in August and September, the numbers decreased markedly and stabilized. But now again, we are seeing an increase in the number of patients and in the number of those who are diagnosed with positive COVID-19 PCRs. And possibly one of the reasons could be the congregations that are taking place, and people are going to into enclosed areas such as marriage halls and restaurants. All of these places have air conditioning, and that is one of the major reasons that you are getting this upsurge.
Right. So, Dr. Qureshi, what exactly worked for Pakistan during the first phase of coronavirus in the country? What was it that was widely appreciated? And if we could, follow the same pattern in the policy while dealing with the second wave, what are your thoughts?
Well, there is no scientific reason that the prevalence of this disease dropped down in Pakistan very rapidly. People always ask questions. Why has this happened in Pakistan? Well, and nobody knows why it has happened in Pakistan. But one of the reasons is that testing is not that vigorous in Pakistan as it is elsewhere. So it's quite possible that we are missing out on the asymptomatic infected people. As far as Pakistan is concerned, we have had a very good response in Pakistan from the authorities, and large number of treatment facilities were added. Existing facilities were converted into treatment centers for infection diseases. And I think Pakistan met with the demands of the pandemic very well. And again, we are well set to take care of another surge in patients. New epidemic diseases hospital has been opened up, which is now catering particularly to COVID-19 patients. But what is going to happen in the future, one cannot predict. Various modeling computer softwares have been used to predict and map out the epidemic, but unfortunately they haven't given a true picture at any time during the last 6 months. But what we really need to do is just to follow the SOPs, and as long as we are doing that, hopefully we will contain the spread of the virus.
So, Dr. Qureshi, the question that we are normally asked, वो है vaccine से मुतालिक. How soon do you think that the vaccine will be available in the market?
Well, there are vaccines which are being tested. They are undergoing phase 3 trials. The first of these vaccines was what is known as the Oxford vaccine. But unfortunately, because of the dealings of the Oxford University with pharmaceutical companies, the major trial went to our neighbor. We are here in Pakistan going through a couple of trials, and the more important one is the Chinese vaccine, the Sinochem company vaccine. And there are trials which are taking place at the moment in Pakistan as well. Pakistan is expected to contribute 20,000 people to this phase 3. And let's hope that things work out. It's not going to be very quick. The results are not going to be very quick because these patients will have a shot, then another shot, and then they will have their immunoglobulins, their antibodies checked, and that will tell us whether after 2 months they have proper levels of antibodies. Otherwise, probably they will again have to be followed up later on.
So we are often asked the questions regarding boosting the immunity against COVID-19. आप इस हवाले से क्या गाइड करना चाहेंगे?
Well, immunity is not something that comes by overnight. You require a healthy diet, you require 30-minute exercise every day, and you require sleep. In addition to there are some remedies which have been floated, such as vitamin D, that you should have high levels of vitamin D in your body, and not so important vitamin C, but vitamin C is generally immunity booster. But a great deal of stress has been paid on vitamin D to be taken. But the main thing is that you should be taking a balanced, healthy diet, and that works effectively.
So going forward, आप क्या देखते हैं in coming months, and is there a message of hope that you would want to give to all of us?
Though there has been a setback on in-campus activities, we overcame this with using technology and having a hybrid system. And in fact, a good thing is that we are probably going to persevere with this hybrid system, and education is probably going to see a change. But all in all, I think we should remain positive, we should remain hopeful, and this is what our religion teaches us.
Thank you very much, Dr. Saeed Qureshi, for joining us.
Okay, thank you. Thank you.
जी नाज़रीन, जैसे कि आज के बुलेटिन में भी हमने डिस्कस किया कि सेकेंड वेव पाकिस्तान में कोरोना वायरस की आ चुकी है। ग्रेजुअली केसेस भी बढ़ना शुरू हो गए हैं और इस वक्त भी वक्त की अहम तरीन ज़रूरत है कि हम SOPs को फॉलो करें और मास्क लगाना हरगिज़ ना भूलें, हैंड सैनिटाइज़र्स का इस्तेमाल करें और सेफ़ डिस्टेंस मेंटेन रखें जो कि 3 से 6 फीट का है। लेट्स फाइट अगेंस्ट COVID-19 टुगेदर।